As you know, the clock is ticking. We've been talking about this for a long time. The president has been pushing for a Senate vote before Christmas, and that means our next two guests have an awful lot to consider. Senator Debbie Stabenow is a Democrat from Michigan, and Senator Orrin is a Republican from Utah. Both of them joining us now with more on this. Thanks for being here to the two of you. I know you've been working hard on both sides of the fence here, so we appreciate your time. Senator Stabenow, I want to start with you if I could. We know that you met with the president yesterday, along with the 59 other senators. He came out of that meeting saying he was, quote, cautiously optimistic. Is this bill going to pass?
Well, I share that cautious optimism, Heidi, and let me just say, status quo doesn't work anymore. Too many jobs are going overseas because of healthcare costs for our manufacturers. Small businesses can't afford health insurance, individuals losing their job, losing their health care. So what we agreed to yesterday was two things. One, that it is time to, as a matter of American policy, say everyone in America should be able to find affordable insurance. And number two, we've got to bring the cost down. So those two things.
So yes, it'll pass? No, it won't.
I believe it will. Yes, I do.
You believe it will pass. Senator Hatch, to you, Republicans, of course, watching all of this unfold at this time, and also watching closely Senator Joe Lieberman and where he is going to fall on all of this. Have you had a chance to speak with him specifically regarding the expansion of Medicare?
Well, John and I are very close, and I'm reading in the papers that he's pretty well agreed with what they've agreed to down at the White House yesterday, so we'll have to see what happens. But I know one thing, he doesn't want a public plan, and what they're talking about, basically having OPM, the Office of Personnel Management, take over this program and have one or two private sector companies put up programs. I mean, if you want another government-sponsored enterprise like Fannie Mae or Freddie Mac, this is the way to do it. And guess who's on the hook for what it costs? It's going to be the taxpayers.
Well, let's say, because what we're hearing, of course, not confirming anything yet, that the senator, and we're talking about Joe Lieberman again, may actually go ahead with voting for the Medicare expansion. So the way that it has been written, the next obstacle would seem to be, if that happens, would seem to be Senator Ben Nelson. And Senator Hatch, I know you were the co-sponsor of the bill regarding federal funding for abortion. It was defeated. What happens next on that front?
Well, I don't know that I don't know what they're going to do on that front, but Ben has told me at least 5 times that he will vote against cloture if they don't solve that problem the way we actually brought it. All we're trying to do is stop them from charging the taxpayers for abortion, and also allowing people with conscience to not have to participate in the acts of abortion. And it's more than that, too. I think Ben's as concerned as I am that they're going to take $500 billion out of Medicare. Now, that's up front. In the first 5 years, the full 5 years, it'll be over $1 trillion out of Medicare. And the full 20 years, it'll be $2.5 trillion out of Medicare. Now, how do you do that for a program that's $38 trillion in unfunded liability as we stand here?
So many numbers floating out of there, and I'm sure, Senator Stabenow, you will disagree with many of those regarding this possible change in federal abortion funding, the Medicare expansion, the public option. What happens when all of those things are potentially gone, and we're talking about compromise here, for your party? Do you go ahead with the bill?
Well, first of all, let me say one of the most important provisions is our efforts to save Medicare. We strengthened the trust fund for 9 additional years. We're going to close the gap in prescription drug coverage completely for seniors. AARP is on board saying this is the right thing to do. None of the benefits that are defined under Medicare are going to be cut. We're simply going to cut back on excessive payments to for-profit insurance companies. And as it relates to abortion, let me just say, and Senator Hatch is a friend of mine, but we have a profound difference on this. We all agree there should be no federal funding. But this goes farther to say if you get tax cuts from the federal government, you can't purchase health insurance with your own money that includes this provision. When we look broadly, highly at this bill, we see a very strong reform as it relates to stopping insurance company abuses. You're going to be able to find insurance if you have a pre-existing condition. You're going to get what you pay for. You won't get dropped when you get sick because of a technicality. Your children will be able to stay on their insurance until age 26. We have numerous things in this bill worth fighting for, and we intend to get it done.
Senator Hatch?
Well, if you think spending $2.5 trillion over the next 10 years or so is the right thing to do, and if you think the federal government's going to manage this better than the private sector, I mean, just look at Fannie Mae and Freddie Mac. This is what they're setting up. And frankly, you know, they're going to subsidize, with federal funds, taxpayer funds, they're going to subsidize people making up to $88,000 a year. I mean, that's just crazy.
Is there any dispute on that, Senator Stabenow?
Heidi, let me just say that, with all due respect, all we hear is complaint, 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 one thing after another, and yet the status quo is not working. We have worked all year to come together to provide an opportunity for a bipartisan approach. The determination was made by the Republican leadership. They'd rather try to stop something that's a priority for this president and this Democratic caucus rather than actually coming together and doing something that affects everyone. Democrats, Republicans, independents, small businesses, people who are in business for themselves. This is actually, the insurance exchange is something that has been proposed in the past by Republicans as well as Democrats. It's very unfortunate that politics has gotten in the way.
Will this ever be a bipartisan issue, Senator Hatch?
If I could just answer that. The original Help Committee bill, total Democrat bill, not one Republican asked to participate. House bill, total Democrat bill, not one Republican asked to participate. Reid, total Democrat bill. Yesterday at the White House, totally Democrat. Then they say that we're not cooperating with them. Hey, we'd like to have a system that works, that isn't going to be a burden to the taxpayers, and isn't going to eat the taxpayers alive, and that will be run not by the federal government, but run, you know, by the competitive system in our society. Look, anybody thinks the federal government's going to run health care better than the private sector, I think just hasn't looked at the facts.
Senator Stabenow, I ask again, is this going to be a bipartisan? Is this going to be a bipartisan bill? Yes, go ahead.
It's going to be partisan.
This is not our choice that it's a partisan bill. We have worked and worked and worked, as Senator Hatch knows. We have worked and worked to bring people together, but in the end,
no, you haven't,
people are not going to care. People are not going to care whether it's Democrats or Republicans who voted for this. What they want to know is, are they going to get what they pay for? Can they find affordable insurance? Are seniors going to get help with their prescription drug coverage? Are we going to bring down costs for small businesses and big businesses? That's what people care about, and that's what we are focused on. Well, and this is about saving lives, saving money, and saving money.
Obviously,
the Congressional Budget Office says that the premiums are going to go up. CMS says that it's going to cost more.
Not the numbers I've seen.
Well, so there's the problem, if I may, with all due respect to the both of you. The problem still seems to be talking about this so far down the line, because you are more aware than any of us being in on these meetings, that we've been talking about it for what seems like an eternity. The numbers are still very, very different from what the Republicans think and what the Democrats think, and the way that this will all line out for the future of America. I don't think anyone disagrees that these are all the things that we want regarding the plan for our families and for our future of health care. But I think it all comes down to, as we've been trying to attribute to the Congressional Budget Office and what numbers they are coming out with, who's going to pay for what and how much will it cost each one of us. And with that, I am so sorry. We could talk for 10 days on this. I know it. We appreciate the time from both of you. We certainly wish you luck in getting all of this taken care of before Christmas. I know that there's been some talk of maybe going through Christmas. So keep talking, keep working. We wish it all comes together for everybody, obviously. Senator Debbie Stabenow and Senator Orrin Hatch, thank you very much.
Thank you.
Want to get to our top